So this is the orthopedic injury model. So what this is basically a complement to the discussion on tissue healing. So much of this is going to essentially be repeat information in regards to tissue injury, but we're actually going to kind of show it in regards to, what is actually happening with tissue. So we're going to kind of present it in a different way that could maybe help your understanding a little bit better. And there's going to be a little bit of an emphasis on some aspects of particularly the inflammation process that we're going to discuss that we didn't necessarily hit on in that other chapter, but just kind of point out some other things that you have to be concerned about during that. So again, probably a good portion of it, just review, and I may even say to refer back to the previous presentation, but there will be a couple smaller new things that I'll point out that didn't really get highlighted as much in the previous discussion. So looking at this, so we're looking at injury. So whenever we have injury, we have cell damage and hemorrhage. So this picture that you're seeing right here, we're going to progress through this. So this picture just represents tissue, okay? So, it could be a ligament, a muscle, just some type of soft tissue in the body. These are the cells essentially here. The red lines represent the blood vessels, the blue lines represent nerves. So this is going to be important when we kind of look at what happens when we have injury. So when we have injury, we have cell death and hemorrhage. We kind of talked about how when you're looking at a tissue and it gets injured, that you would have that really quick, the blood vessels constrict, and then they'll eventually dilate later on. But you're obviously going to have hemorrhage from the actual damaged tissue, damage to the smaller blood vessels that we'll have to tend to. So what does this mean as far as the injury, and what does that affect? So again, beyond just the tissue getting damaged, there's going to be damage to blood vessels, there's going to be damage to nerves. Now, again, when I'm saying there's damage to nerves, it's going to be, again, damaged nerve endings. You're not having, we're not talking that every single injury causes major trauma to peripheral nerves in the body, but there's going to be small nerve endings that do get damaged and irritated from the actual injury. So we talked about the 5 cardinal signs of inflammation already. So again, one thing I was saying was you look to connect the effects of what goes on during the process and how they connect to those 5 cardinal signs. So in other words, what events contribute to which cardinal signs of inflammation. Another issue that you're going to be dealing with is the pain, spasm, pain cycle. So we know that one of the big things that happens in the early stages is one of the 5 cardinal signs is pain. Okay, so why do we get pain? Well, we get pain from, again, the actual damage to the tissue. Obviously, there's going to be some damage to the nerve endings as well, and some irritation from the chemicals that gets released. There's possible that the swelling that comes into the area is also going to cause pain, because that's going to put pressure on nerve endings and things of that nature. So pain begets spasm. So again, if pain's going to create spasm because the body's trying to protect itself, that's also going to produce more pain. So that's the pain, spasm, pain cycle. And that's going to produce a lot of, again, neuromuscular inhibition, because again, the body's trying to protect itself. And again, early on, you're going to get the bleeding. That's going to cause that clot formation. So that whole, we talked about, prothrombin turning into thrombin, and that creates your clot. We're going to talk about that a little bit here. Again, even the clot formation, again, in the hematoma that forms could contribute to pain, because it's going to put pressure on that area and again, continue that pain, spasm, pain cycle. So looking at this, again, we're still looking at our tissue being damaged. We're going to look at some of the hemodynamic changes. So the primary hemodynamic changes, and we kind of talked about this in the previous discussion on tissue repair, but we didn't necessarily get into as deep into some of this. So what's going to happen? So we know that when tissue gets damaged, the initial response is for the blood vessels to constrict, but then they dilate. And again, part of the reason why those blood vessels have to dilate is because the white blood cells have to be able to get out of the circulation into the area to do their job. Now that causes that now while that's a benefit to the process, this also causes some other problems that we kind of have to be aware of. So blood flow is actually going to slow down and eventually decrease in the area because of the fact that the blood vessels are dilating. It's going to kind of reduce the pressure, it's going to reduce the flow, and plus we need that to happen anyway for the white blood cells. But what that's going to mean is you're going to have reduced blood flow to the area, which means your tissue oxygen is going to decrease. Now, the concern here is for the healthy cells in the area. So as you're looking at this picture, you can see not all the cells around here are affected. It's only the initial damaged cells. However, that's going to change through the process of what we call secondary injury. So this is something we're going to expand upon a little bit more in the orthopedic in this discussion that we didn't talk about quite as much. We kind of talked about the things that would cause this, but not really kind of how we practically manage and what we're dealing with when we look at secondary injury. So while we have, again, an area of primary damage, secondary injury is going to affect other cells in the region, and this is going to be what we're going to look to limit from a treatment perspective, with our rehabilitation and applying physical agents. Okay, this is something that we mentioned. We're going to go through it again, swelling. So again, what's causing the swelling? Well, it's a combination of hemorrhaging and edema. There's not a whole lot of hemorrhaging with most of your sports, most of your orthopedic injuries because of the clotting process and everything else. So most of the swelling that forms isn't from bleeding, it's from the edema formation. So again, normal fluid movement occurs between capillaries and uninjured tissue. So as you're looking at this picture, so this picture is showing you again what goes on, normally in circulation, and you have different pressures. So remember we talked about hydrostatic and oncotic or osmotic pressure. So oncotic and osmotic means the same thing. Okay, hydrostatic pressure pushes, oncotic pressure pulls. Okay, so remember we had mentioned that as part of our process. So hydrostatic pressure is pressure from a column of fluid. That's going to put pressure down. That's going to push. Oncotic pressure or osmotic pressure, I'll use those terms interchangeably, is going to pull. So, and you have them on both ends. So you have capillary hydrostatic and capillary osmotic. So if this is your capillary, you have blood flow going through there. You're going to have capillary hydrostatic pressure. It's going to push fluid out. You're going to have tissue hydrostatic pressure. It's going to push fluid back in. You have capillary osmotic pressure, which is going to pull fluid in. You have tissue osmotic pressure, which is going to pull fluid out. Essentially, they're called startling forces. They kind of, in a healthy person, no circulatory problems, no injury, that all balances out. Okay. So again, that's your normal tissue fluid movement. We saw this illustration on the previous discussion. Okay, it's basically the same thing. We have the lymphatics. So yes, some stuff is going to escape. So free proteins will escape, nutrients get out, we reabsorb the free proteins through the lymphatic system. So that's what's causing all of this pressure to kind of equalize. Now, when you have an injury, that whole process changes. Okay, so with injury, and this is really important to know, it's actually the tissue osmotic pressure that affects this, because what's happening with tissue osmotic pressure, because you have all these free proteins and tissue debris, cellular debris in the area, that's going to cause more fluid to come out. So, and obviously the lymphatics are going to be overwhelmed in the case of an injury, so that's where you're going to end up having all that fluid. So the swelling that forms, the primary driver of that is going to be your tissue, your osmotic pressure. Okay. Now, can hydrostatic pressure contribute to it? Sure. So one of the things that we tell people to do, like let's take a very common injury, an ankle sprain. Well, one of the treatments for that is to elevate the ankle. Why do we tell people to elevate the ankle? Well, what that's going to, by elevating the ankle, what you're doing is you're actually reducing hydrostatic pressure. So even if you think, so if someone walks around on an injured ankle, they're going to get more and more swelling, because not only are they going to have the osmotic pressure, which again is the primary driver of it, but they're also going to have the hydrostatic pressure because their limb's in a gravity dependent position. So the pressure from gravity, from the fluid superior to the tissue injury, is going to cause more swelling to occur. So we reduce that by essentially elevating the body part. So that's kind of one practical example that we use in treatment to minimize that. So changes in fluid after injury, just what we talked about, the tissue osmotic, or as we saying here, oncotic pressure is going to increase. The reason why is the tissue debris in the presence of free proteins. Okay. Again, the greater the injury, the greater the edema. So that's going to cause, again, more injury. Obviously, secondary injury is also going to possibly contribute to that. So we want to, again, try to limit that as best we can. Again, understand immediate versus delayed swelling. Again, sometimes in the immediate swelling, what's going to contribute to that is going to be the bleeding that happens, but that's going to be very minimal. Now, again, yes, you could have a major traumatic injury to a major blood vessel, and then you're going to get a lot of bleeding, but there's going to be more to worry about beyond what we're talking about here from a treatment. That's going to get into the whole emergency care thing and having to deal with that. Most of the musculoskeletal injuries that you're going to deal with acutely aren't going to have that. Okay, the bleeding that's going to occur is going to be handled by the clotting process, and it's just going to be from smaller blood vessel damage. And again, the problems that happen with swelling. So again, you know, you're going to get more edema, you're going to get greater secondary tissue injury, which again is going to create another cycle. So then the more tissue injury through secondary injury you get, that's going to cause more swelling. The distance from the tissue to the blood vessels is also going to increase, which is going to then start to limit how much nutrients can get into there for the healing process to occur. And you're also going to get more compression on the blood vessels, compression on nerves. Just that added pressure in the area is going to also increase pain. So you can kind of see how all of these things will connect. And then you're going to get more into the pain spasm pain cycle. So again, what we're looking to do with our treatment is to try to cut these things off at places. You know, obviously we're still letting the process go through, but we're limiting some of these negative effects that could prolong the process. As we kind of look and kind of move the individual through the 3 different phases. Okay, and these are your learning outcomes. So again, there was definitely some new stuff, and we presented some of the tissue healing information in a slightly different light, but we did repeat some concepts, and there were some things we visited. I think that this, coupled with that other previous discussion, should maybe kind of help tie in the process and hopefully allow for a little better understanding.